Hi all. The emergence of new viruses and re-emergence of several viral infections are of particular concern now. Emerging infections can be defined as infections that have newly appeared, that have appeared previously but are expanding in incidence and geographic range, or that threaten to increase in the near future. That includes newly emerging infections by coronaviruses, Nipah viruses, or influenza viruses, and re emerging infections with chikungunya, dengue, and yellow fever viruses. The factors responsible for emerging infections include increase in population, poverty and malnutrition, increased domestic and global connectivity, economic factors leading to population migration, changes in social practices, prevalence of immunosuppressive diseases, unplanned urbanization, deforestation, change in agricultural practices, and also genetic alterations in pathogens. Beginning with smallpox. The earliest evidence of the disease was obtained from Egyptian mummies. The origin of smallpox is not known. It most likely evolved from a terrestrial African rodent virus. The term smallpox was first used in Britain in the early 16th century to distinguish the disease from syphilis, which was then known as the Great Pox. Other names for the disease include pox, speckled monster, and red plague. Smallpox is caused by one of the two variola virus variants, variola major and variola minor. Variola major was the severe and the most common form. Variola minor caused a less severe disease. Variola is a large brick shaped virus. It spread through prolonged face to face contact with the infected person or through contaminated objects. It is not transmitted by insects or animals, and there are no asymptomatic carriers reported. Smallpox virus attacked skin cells. The incubation period was about 12 days. A skin rash first appears on the forehead, then spread to the face, the trunk, and to the extremities within 24 to 36 hours. Asymptomatic infections were rare. The mortality rate was about 30%, which was higher among babies. Those who survived had scars on their skin, and some had blindness also. The earliest method to prevent smallpox was called variolation, which involves inoculation with variola minor. It was done in India, Africa, and China, and it resulted in reducing the mortality rate to 0.5 to 2%. This was done either by scratching the material into the arm or inhaling it through the nose. Lady Mary Wortley Montagu promoted this procedure in England in 1718. In 1796, Edward Jenner, a doctor in rural England, discovered that immunity to smallpox could be produced by inoculating a healthy person with a material from a cowpox lesion. Cowpox is a pox virus included in the same family as variola. Jenner called the material used for inoculation as vaccine. Vacca is a Latin term for cow. This procedure was safer than variolation and did not involve a risk of smallpox transmission. So, vaccination to prevent smallpox was soon practiced all over the world. Edward Jenner introduced this modern smallpox vaccine. During the 19th century, the cowpox virus used for smallpox vaccination was replaced by vaccinia virus. Vaccinia is included in the same family as cowpox and variola, but the origin of vaccinia virus is not known. The last case of smallpox was detected in October 1977, and WHO announced that the disease is globally eradicated in 1980. Eradication of smallpox is considered as the biggest achievement in global public health. People no longer receive routine smallpox vaccination, and smallpox is the only human disease which has been eradicated by vaccination. All non stocks of smallpox were destroyed or transferred to two WHO designated reference laboratories: the United States Centers for Disease Control and Prevention (CDC) and Russia's State Research Center of Virology and Biotechnology (Vector). The possibility of smallpox virus being used as a biological weapon still exists. Next, about yellow fever. The first documented outbreak of yellow fever occurred during the 17th century. In the late 19th century, Dr. Carlos Finlay, a Cuban physician, first proposed the theory that a mosquito transmits yellow fever. Yellow fever is transmitted by infected mosquitoes of the Aedes aegypti species. The virus responsible for yellow fever was isolated in the late 1920s. Incubation period of 3 to 6 days. Symptoms of yellow fever include fever, headache, jaundice, muscle pain, nausea, vomiting, and fatigue. The yellow refers to the jaundice that affects some patients. No specific antiviral drug for yellow fever. The first vaccine against yellow fever was developed in the 1930s. It is extremely effective, safe, and affordable vaccine. A single dose is sufficient to confer lifelong immunity against yellow fever. Influenza virus is one of the most common infectious agent. It is commonly known as the flu. The first pandemic by the influenza virus H1N1 occurred in 1918. It is known as the Great Pandemic, popularly known as Spanish flu. The Asian flu H2N2 occurred in 1957 and Hong Kong flu H3N2 occurred in 1968. In 1997, the H5N1 strain of avian influenza emerged in poultry with closely associated human cases in Central Asia. The first confirmed case of avian influenza from India was reported in 2006 from Maharashtra. An outbreak of a new type of influenza A H1N1 pandemic occurred in June 2009. Usually, the influenza virus spreads through the air. It can also spread by touching surfaces contaminated by the virus and then touching the eyes, nose, or mouth. The incubation period for flu is about 1 to 4 days. The most common symptoms are high fever, runny nose, sore throat, muscle and joint pain, headache, cough, and feeling tired. Frequent hand washing reduces the risk of viral spread. Influenza viruses are constantly changing. So, a particular influenza vaccine confers protection for not more than a few years. Social distancing strategies such as quarantines, travel restrictions, cancelling mass gatherings, and closing of schools have been employed to slow the spread of influenza viruses. Dengue is a mosquito-borne viral infection. The virus responsible is called dengue virus. In 1943, the dengue virus was first isolated. One of the worst mosquito-borne human pathogens is dengue virus. The largest number of dengue cases ever reported globally was in 2019. Dengue virus is transmitted by female mosquitoes, mainly of the species Aedes aegypti. Person-to-person transmission does not occur. Dengue virus can cause an acute flu-like illness, incubation period of 4 to 10 days. Signs and symptoms of dengue fever include severe headache, muscle, joint, and bone pain, macular or maculopapular rash, and minor hemorrhagic manifestations including epistaxis, bleeding gums, and hematuria. Severe dengue is a leading cause of serious illness and death. Common names for dengue fever is breakbone fever, and dengue hemorrhagic fever and dengue shock syndrome are the severe forms. There is no specific treatment for dengue. The first dengue vaccine, Dengvaxia, was licensed in December 2015. On May 1, 2019, the US Food and Drug Administration announced Dengvaxia, the first vaccine for the prevention of dengue disease in people ages 9 through 16 who have laboratory confirmed previous dengue infection and who live in endemic areas. The WHO stresses that the vaccine is not effective on its own to reduce dengue fever in areas where the illness is common. So, two dengue vaccines are being developed in India. Now, Zika. Its name comes from the Zika forest of Uganda, where the virus was first isolated in 1947. Since the 1950s, it has been known to occur from Africa to Asia and reached the United States in 2016. Zika virus spread mostly by the bite of an infected Aedes aegypti mosquito. It can also spread from mother to baby. If a pregnant woman is bitten by an infected mosquito, the infection can cross the placenta and infect the fetus. The virus can also be transmitted through blood transfusion or laboratory exposure. Incubation period is of 3 to 14 days. It often causes no symptoms or only mild symptoms. Symptoms may include fever, red eyes, joint pain, headache, and a maculopapular rash. It has also been linked to Guillain-Barré syndrome, a condition in which the immune system attacks the nerves. Zika virus can spread from a pregnant woman to her baby. This can result in microcephaly. Babies are born with underdeveloped heads and severe brain malformations and other birth defects. It may develop after birth also. There is no approved drug or vaccine. A number of vaccines are under clinical trials. VRC5283 DNA expressing Zika virus pre-membrane and envelope, vaccine regimen of 1 milligram in 2 doses with an interval of 4 weeks. Next, chikungunya. The first recorded outbreak of this disease may have been in 1779. The virus was first isolated from Tanzania in 1953. Its name is derived from a word which means that which bends up. The first outbreak in India occurred in 1963 in Kolkata, followed by another outbreak in Chennai in 1964. It re-emerged in 2005. The reason for re-emergence was reported as a mutation in envelope protein E1, leading to a change in the amino acid at position 226 from alanine to valine. Chikungunya virus infection spreads by the bite of the infected female Aedes mosquito. It is not transmitted from human to human. The incubation period ranges from 1 to 12 days. The symptoms include fever, headache, rash, and joint pain. It affects various joints like wrists, ankles, and feet. Chikungunya disease does not often result in death, but the symptoms can be severe and disabling. Most patients feel better within a week. In some, the joint pain may persist for months or years. After a single infection, most people become immune. There is no specific drug or vaccine available. A live attenuated chikungunya virus vaccine and a virus-like particle vaccine are under development. Control of the vector is important for prevention of transmission. There is a risk that the virus may be transported to new areas by infected travelers. So travelers can protect themselves by preventing mosquito bites. Measles is one of the world's most contagious diseases. It is spread by coughing and sneezing or close personal contact. The virus remains active in the air or on infected surfaces for up to 2 hours. The virus infects the respiratory tract, then spreads throughout the body. In 1954, the virus causing the disease was isolated. The first sign of measles is usually a high fever. Begins about 10 to 12 days after exposure to the virus. Lasts 4 to 7 days. Small white spots inside the cheeks can develop in the initial stage. After several days, a rash erupts, usually on the face and upper neck. Over about 3 days, the rash spreads, reaching the hands and feet. The rash lasts for 5 to 6 days and then fades. On an average, the rash occurs 14 days after exposure to the virus. The most serious complications include blindness, encephalitis, severe diarrhea and related dehydration, and severe pneumonia. There is no specific antiviral drug exists for measles virus. The measles vaccine has been in use for nearly 60 years. Licensed vaccines to prevent the disease became available in 1963. An improved measles vaccine became available in 1968. It is safe, effective, and inexpensive. It is often incorporated with rubella or rubella and mumps vaccines. It is equally safe and effective in the single or combined form. Two doses of the vaccine are recommended to ensure immunity and prevent outbreaks. Ebola virus disease first appeared in 1976. It occurred in a village near the Ebola River from which the disease takes its name. The 2014 2016 outbreak in West Africa was the largest Ebola outbreak. The 2018 2019 outbreak was highly complex. The virus is transmitted to people from wild animals. It spreads in the human population through human to human transmission by contact with the skin or body fluids of an infected person. The incubation period is from 2 to 21 days. It causes fever, body aches, and diarrhea, and sometimes bleeding inside and outside the body. It damages the immune system and organs. There is no specific treatment available. Vaccines to protect against Ebola are under development. An Ebola vaccine, RVSV Zibov, was approved in December 2019. Nipah virus was initially isolated in 1999 in Malaysia, followed by an outbreak in Singapore. It is named after a village in Malaysia, Sungai Nipah. Nipah virus infection reported from Bangladesh from 2001 to 2008 with 8 outbreaks annually. The first Nipah virus outbreak in India occurred in 2001 in Siliguri, West Bengal. In May 2018, an outbreak occurred in Kerala. Pteropus species fruit bats or flying foxes are the natural reservoirs for these viruses. The virus is shed in the urine of bats and found in fruits partially eaten by them. It can be transmitted directly between people. The incubation period ranged from 5 days to 20 days. In infected people, it causes asymptomatic infection to acute respiratory illness and fatal encephalitis. Symptoms include fever, headache, drowsiness, disorientation, mental confusion, coma, and finally death. There is no treatment or vaccine available for Nipah virus infection. Research on development of vaccines has been ongoing. Now SARS, MERS, and COVID-19. SARS or severe acute respiratory syndrome first infected humans in southern China in 2002. SARS coronavirus identified in 2003. It is thought to be an animal virus from an animal reservoir, perhaps bats, that spread to other animals such as civet cats. Transmission is primarily from person to person when an infected person sneezes, coughs, or comes into face-to-face contact with another person. Symptoms appeared 2 to 7 days after a person was exposed to the virus, and symptoms include fever, malaise, myalgia, headache, diarrhea, and shivering. Cough, shortness of breath, and diarrhea are present in the first or second week of illness. Most of the fatalities associated with SARS resulted from respiratory failure. SARS can also lead to heart and liver failure. The group most at risk of developing complications is people above 60 years of age who have been diagnosed with another chronic condition. No drugs appear to be effective against SARS. Experimental vaccines are under development. Middle East Respiratory Syndrome or MERS first identified in Saudi Arabia in 2012. Scientific evidence suggests that camels are the animal source of MERS infection in humans. The virus passed from person to person through close contact among family members, patients, and healthcare workers. The symptoms usually appear 5 to 6 days after exposure to the virus. Typical symptoms include fever, cough, and shortness of breath. Pneumonia is common. Gastrointestinal symptoms have been reported, and some are reported as asymptomatic. No specific treatment or vaccine is currently available for MERS. However, several MERS coronavirus specific vaccines and treatments are under development. In 2019, a new coronavirus, SARS coronavirus 2, emerged, causing the current COVID 19 pandemic. It likely originated in infected animals marketed in an open air food market in Wuhan, China. It spread from person to person through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. But it can also be left on objects and surfaces. So if you touch something contaminated and then touch your face or another's face, you might fall ill. Patients with COVID 19 have reportedly had mild to severe respiratory illness. Symptoms include fever, cough, shortness of breath. At this time, there are no treatments or specific vaccines for COVID 19. There are ongoing clinical trials evaluating potential treatments and vaccine. RNA viruses mutates a lot. Getting a vaccine against RNA virus is difficult. If virus mutates, a vaccine today may not be helpful tomorrow. Nature abhors the vacuum. Thank you.